Hello, everybody. I'm Julie Carter, Professor Emerita in Neurology at Oregon Health and Science University. And I just want to welcome and thank you all for being part of this first webinar in a 4-webinar series that will be occurring over the next, through the end of the year. And these webinars are primarily for care partners and, of course, the people they live with. But before I really go on with this webinar, I do want to acknowledge one thing, and that is that we are truly living in a very uncertain time. And we all appreciate that it's very stressful for everybody, but particularly people who are living with a chronic illness. So all of us hope that you are well and that you are finding ways to cope. And we hope that this series will offer you a little something, but more than that, that you will know that you're not alone. And I want you to know that today you're really not alone. There are over 500 registrants signed up for this webinar, and you represent 25 countries. And most of you have been at a WPC before. So that is just absolutely, absolutely terrific. I want to say a word about how this webinar actually came into being. At the last WPC, we got feedback from people who attended the Care Partners Lounge. And if you don't know what the Care Partners Lounge is, it's a place where care partners go for education, they go for support, and they go for community. And it's been very popular. And we got the feedback that they would like to take it in a virtual setting. And so here we are, that's what we're doing. And today we are going to have the very first panel, and all these topics have been thought of and organized by care partners. So they should be very pertinent. Our topic today is about how to manage medication and the role of the care partner. So I might just say that this is a very important topic because it does require partnership. And we actually know from research that we've done that couples who manage this disease together and think of it as our diagnosis, not your diagnosis or my diagnosis, actually cope better over time. Not only do they cope better, but they have better mental health. So we hope to facilitate that by this particular panel. A couple of logistics. One is that you will have an opportunity, and you already know this, to submit your questions. We will be collating those and then answering most of them at the end of all 3 speakers. We might take one immediate question after each talk, but again, the majority of them will be done at the end of the 3 speakers. You have an excellent panel today to present to you. I would like to briefly introduce them before their talk. First of all, we have Dr. Mantri, who is a movement disorder specialist from Duke University, and we're very excited to have hear her today. Lisa Mann, who is a former colleague of mine and a nurse extraordinaire, an expert in Parkinson's disease, and will be providing you with a lot of interesting information. And then Kat and Ken Hill, also from Oregon. I actually am just meeting them for the first time. It's wonderful to meet you both. And they have attended both the 2016 and 2019 WPC, and we're so thrilled that Kat is actually a program committee member for the upcoming WPC in 2022 in Barcelona. So please come. My last comment before we get started on this panel is to thank our 2 sponsors. We have 2 amazing sponsors, US World Meds and Adamus Pharmaceuticals. We are so pleased that they have supported us. And in fact, we simply wouldn't be doing this without them. So thank you from the bottom of our hearts. So let's get started. First of all, we're going to start with Dr. Mantri, who is going to talk to us about what care partners should know about medication management in Parkinson's disease. Dr. Mantri.
Wonderful. Thank you, Julie, and welcome to everybody on the webinar. I'm really excited to be able to share thoughts with you about medicines in Parkinson's and what care partners can do to help support their loved ones with Parkinson's. As you all may be aware, this is a huge topic, and we could talk for an hour or more about meds, but I want to just kind of touch on some highlights about what we think about as clinicians when thinking about medicines for patients and families before we really get to the meat of it, which will be experiences from Lisa Mann and then Kat and Ken Hill, who have really been living with us and can give you the real scoop, if you will, on meds. So I think one of the most important things to keep in mind with medicines for Parkinson's disease is that there's lots of different options for medicines. And different medicines are going to work on different symptoms, and they're going to work in different degrees on people. So it's a very sort of personalized decision as to when to start medicines, which medicines to start, and what to sort of how to find that balance between a good effect of a medicine and a potential side effect. The one thing that I always try to keep in mind when talking to patients and families with Parkinson's disease is that the goal of medication in this disease is to try to restore function and help keep people doing what they need to do or what they like to do with their daily life. As of yet, we don't have any curative medicines for Parkinson's. There's lots of really exciting clinical trials looking at potential cures. So I'm very hopeful that in the next few years we'll have a cure for the disease, but we don't have that yet. What we do have is some very, very effective medicines that'll help control symptoms and help keep people active and living their best life with Parkinson's. One thing that I think can be a little bit challenging for patients and families when talking about medicines with their clinician are the ways that we use language around Parkinson's disease symptoms, and especially the language around medication effects and side effects and what's working and what's not. So some of the things that you might hear from your doctors and nurses when talking with them about Parkinson's disease are we sort of mentally divide things into motor symptoms. So those are things like stiffness, slowness, tremor, gait problems, falls. Those all kind of get classified as motor symptoms in our mind. And then non-motor symptoms are really everything else about the disease. So mood symptoms, memory symptoms, constipation, sleep problems, those all will go along with Parkinson's disease. And those are as important to try to get a handle on and treat as some of the more, what we used to think of as the classic symptoms, the motor symptoms. But I think increasingly in the last few years, we as doctors have been much more aware of the impact that all of these non-motor symptoms have on people's quality of life. And so we're trying to remember to ask about them more, but I do want to encourage patients and care partners that if you're experiencing non-motor symptoms to bring that up to your doctors, because there's a lot that we may be able to do to help you manage those challenges. The other thing or the other kind of terminology that we use a lot is on time and off time. And so you may hear this a lot with meds. We call on time when medicines are working well, when symptoms seem minimal, and when things seem, some of my patients refer to it as being close to normal or back to normal or the new normal, if you will. And then off time, by contrast, is where medicines have sort of tended to wear off. So often as the next dose is due, people start to notice that their tremor comes back or their walking changes or some of their other symptoms may start to sort of come back as their medicine sort of wears out of their system. And we call that off time. Usually for many people, early in the disease, People tend to have, spend most of their time in the on state with medicines once you sort of tweak medicine timing and everything. And people can generally have a pretty prolonged on time. But as the disease continues to progress, people will sometimes start to convert to having more off time or more prominent off symptoms or sudden wearing off. And we refer to that as the therapeutic window. So this sort of window of time during which the doses can be adjusted and changed to try to, again, maximize the amount of time you spend in the on state and minimize some of that off state. And so you'll hear doctors and nurses talk about that a lot when we ask people about medicines. Do you feel like you're on? Do you feel like you're off? And what symptoms you experience in each of those states. As I alluded to before, there's lots of different options for meds, both for the motor symptoms and for the non-motor symptoms. And I'm not going to go into a lot of detail about specific medicines as part of this talk because, it's such a personalized decision. But for the most part, just on a very general level, a lot of the motor symptom medicines, so things that treat stiffness and slowness and tremor, tend to be dopamine-based medicines. One of the key challenges with Parkinson's disease is that your brain isn't making enough dopamine. And so we're trying to sort of replace or give you back the dopamine that your brain isn't making on its own. And we have a few different ways of doing that, ranging from medicines that boost your brain's sort of dopamine production or trick your brain into thinking that there's more dopamine around than there really is, all the way to levodopa, which is a form of dopamine that gets converted by your body and brain into something quite close to natural, if you will, dopamine, and is really kind of a relatively close replacement to your brain's own natural production of dopamine. So those are for the motor symptoms, are largely dopamine-based strategies. For the non-motor symptoms, things like mood and memory and urinary symptoms and constipation, we have a lot of different ways of trying to manage those. Some of it is things that are drawn from what we know about, for instance, memory disorders in other contexts or depression in other contexts. Some of it are medicines that are designed specifically for these situations in Parkinson's disease. So just as one example, in the United States, the only FDA approved medication for cognition in Parkinson's disease is ribostigmine, but we often will use other medicines to help boost cognition in Parkinson's, regardless of FDA approval. So it really is a very kind of individualized conversation with your care team about which medicines are the best for you and what works well for you in terms of controlling your symptoms the best. And then I just want to touch really briefly on some of the things that come up when I'm talking with patients and families about when to consider starting medications. This is going to, again, be a very kind of individualized decision, but the biggest thing that I think seems to draw people into deciding to start a medicine or switch to a different medicine is when their symptoms are causing functional limitations or limiting your quality of life. So whether that's from the physical symptoms or the non-motor symptoms of Parkinson's disease, once that disease is interfering with your ability to do what you want to and need to do on a day-to-day basis, that's a reason to start a medicine. And finding that balance between the good effect of the medicine and the side effect can be a little bit of a challenge, and it can require some tweaking and trying different things over time. So I'd encourage people not to be discouraged if the first thing that they try either doesn't seem to work or causes, significant side effects, because there are so many other things that we can adjust and try. And then just to be have frank conversations with your doctors and nurses about what you're experiencing, because you are the ones living with this on a day-to-day basis, and we rely so much on the patient's story and the care partner story as to when we make a recommendation to change things or to adjust things or to switch to a different medicine. So keeping track of things, keeping a log and so on. I know Lisa is going to go into a lot more kind of practical detail about a lot of this, but it really is so important for us as doctors and nurses when we're trying to figure out how to help you live well with Parkinson's. And then I do think that it's important to have a Parkinson's specialist of some sort on your care team, whether that's a Parkinson's nurse or a Parkinson's doctor, or even kind of the support groups through the Parkinson's Foundation and WPC and so many of these other foundations, because there's so much going on in the Parkinson's world, and it can feel very overwhelming. So I think it's helpful to have folks that you can reach to for a little bit of a guide in navigating this journey for yourself and for your loved ones. So that's all I wanted to say.
Thank you very much, Dr. Mantri. Actually, I'm going to just one quick question, and then we'll move on to our next speaker. But one question is, do you feel that there is any difference between trade brand and generic medication?
That's an excellent question. So I would say for most people and for most medicines, there isn't a significant difference between branded and generic forms of medicines. In order for a generic to be approved for sale, it has to sort of fit within a very tight parameter of what the brand does on a molecular level. There are some cases, though, where I've certainly had some patients who said, I feel that brand X is really, really helpful for me. And when the pharmacy gives me the generic version of it, it doesn't seem to work as well or doesn't seem to get absorbed as well. So I would say, as with everything else, it really is an individual decision. And that's where things like keeping a log or keeping track can be very helpful in terms of tracking whether, a switch to a generic has been less effective for a person. But for the vast majority, I'd say probably 90 to 95% of situations, there isn't a significant difference. There's just that small minority where people may be extremely sensitive to the differences between brand and generic. And if you're one of those people, definitely being on brand would be more helpful.
Thank you. Yeah, that's very, very helpful. It's important. People wonder about that all the time. So our next speaker is Lisa Mann, and Lisa is going to be speaking to us about tips and tricks for improving communication for couples around medication management. Lisa.
Hi, everyone. So yes, as Julie said, I'm going to talk to you about really how to talk to your loved one and healthcare providers about medications. So it's going to be kind of the why and the how to do this. First, the why, and this is really around communicating with your loved one. Depending on the stage that your family member is at, you may or may not be involved with their medications right now. And the truth be told, some people don't ever want to be involved in helping out, but we're going to kind of address both those issues. So hopefully you'll understand better that kind of the whole theme of my talk is that care partners really can make a huge difference in the outcome of administration of medications and making sure that their loved ones function as highly as possible, kind of what Dr. Mantri touched on as well. So one of the facts is Parkinson's disease is going to progress. We're not slowing it down. We're not curing it. The medications help greatly, but it's going to progress. So motor and non-motor symptoms will worsen. The medication regimens will have to be changed and will become more complicated. So just given those realities, we understand that there's going to be a need to change and know how your loved one is responding to medications in order that they get the best response from them. And so what if your loved one doesn't really want you to be involved? Because some don't. Some look at it as, kind of an intrusion, or maybe that it's a power play or controlling, or just a signal, a loss of independence and competence, which are, valid feelings to have and do need to be recognized. But what I suggest is that you kind of depersonalize the conversation. Really, it comes down to two things: safety and quality of life. And by what I mean quality of life, if medications are optimized, then the individual will be able to have the best function, movement, mood, everything else, motor and non-motor symptoms possible. And that means that they'll be able to stay involved, doing the things they enjoy, doing the things you both enjoy. And that will also lead to them being more active and being safer. So what about safety? It comes down to a couple different examples that I can kind of give you to illustrate it. I mean, obviously, if they're moving well, and if they're able to keep their exercise up and their activity up and their mind involved, they're much more likely to be fit, to not sustain falls, and to be able to participate in all kinds of activities. And that's just good for our well-being overall. But let's say they take too much medication and have an adverse reaction. And that can range, like if you get too much levodopa, an individual can have involuntary movements like dyskinesia, or they might have hallucinations. Well, where dyskinesia is concerned, when someone is on, when they're functioning well, they may not even notice that they're dyskinetic, but you will be able to. And that'll be important information that the provider will need if they want to adjust their medications. Also, their specialist will need to know, more about kind of the 360 view of the individual. Now, the person with Parkinson's, they know their symptoms. They know their bodies from the inside out, but you've been with them probably for many years, and you kind of know the subtleties of when they're not doing well, or if they happen to be moving a little more awkwardly. And that information is very vital for the provider to know to make adjustments. And finally, if an emergency occurs and they have to go to the hospital, we already know that hospitalization can really bring an individual with Parkinson's disease make them much, much worse if their medications are optimized to the best ability possible. And you can be helping with that. And I want to mention here an important tool that you can utilize. The Aware and Care Kit can be very beneficial. It has educational materials. You can get one at awareandcare.org. And it'll help you kind of be the advocate for your loved one if that occurs and you need to go to the hospital. So in sum, communicating is, depersonalize it. It's about safety. It's about quality of life. And you want to help them have the best quality of life. And then what if you don't really want to be involved? Well, in the end, it's about safety and quality of life. You don't have to know everything, but do know the basics, what the medications are for, what they're supposed to do, and if they're not working, what happens. so that you can, again, advocate for them in an emergency situation. So periodically check in with them, know where their medication is, list is, and that it's kept current. And it is a good idea to attend the appointments with the specialist, because that'll make all the difference in getting that 360 view for the provider to be able to make changes. So the second half is, how do you communicate with a healthcare provider so that you do get the best results? And I want to say that really you need to prepare in advance, whether you're just calling to talk to the nurse or you're going in with your loved one to an appointment. There are certain things they need to know. And if you're able to provide that information, this is where they'll be able to give you the best advice possible and make the medications changes most appropriate. As Dr. Mantri said, everybody's an individual. It's going to take some trial and error. But again, we want to make sure that there's less trial and less error and more likely to hit the bullseye when we're making changes. So to do that, be able to describe basic things: what, when, where, how, and why. So what is happening exactly? Try to describe it in a very concise way. And I know it can kind of be confusing to do, but where is the problem happening? What part of the body is the tremor? On the left or the right? Is it the hands or the feet? Is it both? Make sure that you're kind of taking all of that in. And when does the problem occur? Did it happen all of a sudden, like one day he was fine and the next day he's not? Or was it gradual over weeks or months? And then does it happen every day, several times a day, only during the day, only at night? Kind of figure out the timing of it. And how do different things help? Particularly, you have to know, how does the administration of the person's Parkinson's medication impact them? Does it really help the issue that's happening? Does it make it worse? Or does it have no impact at all? And finally, kind of think about what's changed. Is there something new or different that's happened in that person's life? And this is where the tool I recommend, and Dr. Mantri talked about, is a medication diary. Again, you can get different ones from different places. Your physician probably has one, or your nurse practitioner or physician assistant, but get one of those. Parkinson.org. The Parkinson's Foundation website also has one, and keep it for a couple days if you have that amount of time to be able to see a pattern. So that should prepare you to really give the information to the provider that they need so that they can help you and your loved one out to obtain the best function and the best quality of life. And finally, in addition to the two tools I've mentioned, so the medication diary, a wear and care kit, but also get a copy of the medication booklet from the Parkinson's Foundation or from any excellent resource, but they have a downloadable one, or you can order one for free at parkinson.org, and learn about the medications that your loved one is taking. And again, all of this will help you help them have the best quality of life. So your role is vital.
Thank you very much, Lisa. Again, just one question, and before we move on to our final speakers, you mentioned the diaries, you mentioned aware and care, but one question was about other tools. The question was, we're having such a hard time keeping track of all our medications, and how should we manage that?
So I think it's really important, because once again, these are going to become fairly complex medication regimens, to have a very reliable medication reminder tool. So that may, mean and actually I highly recommend cell phones. There's different apps for them. They can have multiple alarms on them. You can keep track of many different medications, and the alarms will make you register whether or not you have taken them, particularly depending on the type of app you use. There's quite a few of those out there. If you prefer not to, or you don't have a smartphone, there are some excellent medication reminder websites. And I suggest Googling it and looking into those and really asking yourself some questions before you get a medication reminder. Is, does your loved one have hearing or vision issues? Is there, do you need more than 4 alarms in a day? And often with Parkinson's, you do. Find out the features that you're going to need to make sure that it's effective for them to utilize. And then have a really good list that you both know of those medications and keep it current.
Okay, good. Thank you very much. Now we're going to hear from Kat and Ken Hill, who are going to be sharing their personal story about Parkinson's disease, specifically about how they manage the different therapies and medications with their disease. Kat?
Right.
I don't know which of you wants to start first, but
I'll start.
Okay.
So I was diagnosed in 2015 at the age of 48, and I was a clinician and delivered babies for a living before I left my job. And so I knew a fair amount about Parkinson's and about medicines. And my father had Parkinson's. But I was still pretty blindsided by the diagnosis. And I think that the most important tool that we have as a team is communication. And I think everybody has talked about it. And I think it's something that if you can't communicate about dinner times and school plays and who's taking what child to what event, it's difficult to manage communicating about hard things like diseases and medicines. And I've suffered from a real sense of trying to be in control of what I'm doing. And because it's my background, I feel like I should be an expert at all things. And I am guilty of being too independent and a little stubborn. But I also think that Ken and I over the years have developed a good dance and a good way of communicating even the hard things. And I will say, if I can offer any piece of advice to couples, and that is, in the heat of the moment, don't try to solve the issue. Back off, and if there's concerns or challenges, take it to the next day, do it over tea, do it with kindness and love, and learn to be really honest with each other. It's hard on the ego to hear that he's noticing symptoms, or I feel like sometimes I'm doing things wrong if he's noticing them and I'm not managing them well. So I think really being honest with yourself and study your symptoms, study your disease. You are really in the driver's seat. You know your disease better than anybody else. You know your body better than anybody else. And learning to be honest with yourself about your symptoms, about the progression, and looking at your medicines as tools. You have a zillion tools at your disposal. Medications are only one of those tools. You have exercise, you have being social, you have massage, you have physical therapy, occupational therapy, you have art therapy, you've got pet therapy. Your medicines are just one of your tools, and being honest both with yourself about your disease process and your partner is really important. I also think that it's important, I'm taking a look at my notes here, to use your experts and to learn to study your disease and be concise before you go into appointments. Meet with your care partner before your appointments. Get on the same page about what the dialogue will be, so neither one of you feels blindsided in the appointment either. That's important. So that you go in sort of as a united front and say, hey, I've noticed this, or hey, I've noticed that. You can use lots of tools. The Davis Phinney Foundation has some wonderful tools too. Parkinsons.org. In Oregon, we have Parkinsons Resources of Oregon, where those of you that have partners are really blessed to have a partner in the journey, even on the hard days. So learning to talk about the hard stuff is important. So, all right, I'm going to leave it with Ken.
Okay, thanks. So I'm the care partner in this fabulous relationship. Kat, I really love how you use the term dance, because it really is. And from Lisa mentioned safety, and what was the other one?
Quality of life.
Quality of life. I'm going to add a third one, peace of mind, and that's for the care partner, because I've really had to, we're in this dance for 5 years of Parkinson's, and I just recently started learning the medication regimen. I'm bad at it. Kat and I, our family, we have 3 kids. Our youngest is 23 now, and when he was 8 years old, was diagnosed with type 1 diabetes. And we had to learn a medication dance with that. And I actually really deferred to Kat, because she's a clinician and she's good at it, and she picks it up like that. And for me, it's hard. It's hard to calculate dosages and schedules, and it's really difficult for me to learn. So I had to get to a peace of mind of how I'm going to do that. And so I had a fallback. I had a plan B with our son, and that was my wife. And I really deferred to her. But with Parkinson's, where, many years later, I have to find a plan B. I don't have that right now. And so that's something new for me. I needed to find another, like my backup. I'm Kat's backup in her medication regimen, and I need to find my own backup. And I just started learning about her medications probably within the last year and a half, and how they work and what their schedule is. And I've heard some good ideas. And what I use is a smartphone. I put all of her medications on a note on my iPhone, and I use the calendar in there for medical appointments. I go to all her medical appointments, and we have a set aside time a day or two before the appointment to just sit down and say, what do we want to talk about with our neurologist, or even our primary care doc if it's a primary care appointment. So for me, it's been recently learning how the medications work, and realizing, coming to peace of mind that I'm not going to learn it quickly, and being okay with that, and using the tools that are available for me. It's just another, I thought many years ago, after we learned the diabetes and insulin regimen and blood sugar testing, that, okay, we could do anything, but you know what? Parkinson's is a little different. It's a different medication regimen. It's a different, it's a progressive illness, and whereas diabetes, when you take insulin, you're taking care of yourself. It's just a little bit different. So be kind to yourself, get a plan B, a backup person, and that's somebody I need to identify. And I'm working on that. That's all I have.
All right. Thank you both so much. A question to both of you is about when you notice, well, it's 2 sides of the same question. So first of all, to Kat, what you do when you start noticing changes, but you really don't want to talk to Ken about those, or may not want to talk to him, because it can represent a number of things. It can represent progression you don't want to see. It can represent a dependency you don't want to experience. And more than that, you might not want to worry him. And Ken, to you, when you notice something that Kat hasn't mentioned, what you do about talking to her about that, because 1, you may not want to worry her. You don't want to describe progression to her. And more than that, you don't want her to feel dependent or as if she isn't in charge of herself. So how do you guys handle that?
All right, Kat, do you want to go first, or do you want me to go first?
No, it's your turn.
That's a really hard question, and I'm just going to be brutally honest. For me, it's about timing. Find a time that is good to talk for both of you, and don't do it quickly. And Kat and I just had one of these a couple days ago. I sat down. I said, Kat, I need to talk with you about your Parkinson's. When is a good time to do it? And she said, how about now? I took a deep breath and I said, okay. And I did. And we talked about it. And so for me, it's all about timing and finding the convenient time for both of you to talk, and expect that it's going to be, give yourself plenty of time, because it can be emotional. I mean, there's going to be crying on both sides. It's going to happen, and that's okay. And that's part of the communication piece. Go ahead, Kat.
So I think this is part of the dance. I think that I under respond to progression because I don't want to blame or be hyper alert about everything that I'm experiencing. So I give it time, and before I blame it on Parkinson's. I mean, in my brain, I blame everything on Parkinson's, crooked teeth, static cling. It's all Parkinson's related. But until I'm feeling some impact, and sort of my baseline is when I'm having trouble getting to my exercise program, then I feel like I need to have some intervention or make some changes. I am learning grace with myself and with trying to accept feedback from the people that I love, that they're noticing something. And it's a process. But it can be a really beautiful thing, because it's learning how to accept and not just give. And I think particularly for women in our culture, we are the caretakers. We are the ones. I'm a nurse and a nurse practitioner. I'm supposed to take care of everybody. How do I let people take care of me? Well, that's a gift to learn how to do that. And it takes time to learn how to do it. I totally agree with Ken. Bringing things up at the right time is important. And accepting that sometimes it's hard, and new normals are hard, and incremental loss is hard. But it can be graceful, and it can be loving, and it can be funny. So.
And one thing I like to add is when I talk about it, something I've had to learn is I have a tendency to try to fix everything. I think a lot of my male friends are like that. When we get a problem, we just want to go fix it. And I've learned that when we have these conversations on symptom changes, it could be a progression issue, or it could be a side effect of the medication, and we talk about it, I immediately know my brain's going to go, I know the fix, Kat. This is what you have to do. But I've learned not to do that, because that is just not effective communication. We just, even though I want to fix it, I want to make my wife feel better, less painful. It's good not to start there.
Thank you both very much. And I'm going to we're getting a lot of questions coming in, so I want to get to some of those. I want to also mention that this series, for those of you who are wondering, it's actually going to be, I'm just getting a message that the content's going to be compiled and available online as soon as after the webinar. So just so you know that if you want to look back at any of this. We're getting a lot of good questions, and I'm actually going to start with one to Dr. Mantri, because I think this is a bit of a concern about neurologists. And I want to hear your opinion, or we want to hear your opinion, and how you would advise a couple to handle this, which is that they're saying that when they go in to see the neurologist focuses totally on the patient and totally on the patient's needs, which they understand completely. That is the patient. But if the person that they live with doesn't answer correctly, is it appropriate to correct their loved one?
Oh, that's a very good question. And that is a real, I think, challenge that a lot of patients and their families are grappling with. Whenever you have multiple people in a room, everybody in that room is going to have a different perspective, and everybody's perspective is going to be, I think, part of what the final decision plan ends up being. I think one of the big challenges that I see sometimes is care partners or other family members feeling nervous about speaking up in a exam room. Like sometimes, this happens all the time. I feel like I'm talking to a patient and out of the corner of my eye, I see the care partner sort of nodding or shaking their head or making facial expressions. And when I notice that, I try to sort of turn and say, well, what's your kind of point of view, or what would you, it seems like you have a different perspective to add here. Sometimes it's not always possible in a clinic visit if the provider doesn't sort of pivot in that way. And so sometimes this is just one thing that's come up a couple of times when care partners have felt they didn't want to embarrass their loved one, for instance. They'll send me a message either before or after the appointment through our patient portal system, if their loved one has given them access to that, or call or something like that on the phone, and we'll talk that way if we need to. But I do think that it's important that for the clinician to hear that care partner's perspective, because as I think all of us have talked about, everybody in this journey has a different point of view, and the patient can give you or is experiencing one thing, but the care partner, from seeing it from a different angle and from living with that person and seeing them on an ongoing, everyday basis, can really, I think, provide a lot of support. So I'd encourage, any patients listening to do, I love what Kat and Ken do, like sit down together before the appointment and come up with a game plan and talk about some of these issues. But sometimes if there are issues that you don't want to bring up, often because, sometimes patients have cognitive problems or psychosis, hallucinations, things like that, that might feel embarrassing to sort of tattle on your loved one. And I think sometimes finding these other ways of reaching out on the phone or through the patient portal can be really helpful, both for the care partner to get some support, but also for the provider to then make a decision about adjusting medicines or changing things around or adding new medicines to help control new symptoms, like that.
Okay, thank you. The next question I have is, I'm going to, actually all of you probably have something different to add to every single one of these questions, but I'm going to direct this one to Lisa. This is about what a person should do if they notice that their family member is late for their medication or misses a medication, but doesn't like to be instructed about their medication. How do you handle that?
Well, I'm hoping that Kat and Ken can weigh in on this one too, because that is a difficult situation. And again, I think it is best approached in a depersonalized way. So simply, stating just kind of as a question, by the way, I noticed there's still a pill in your pill box for the 10 a.m. dose. Did you miss it? Or, did you forget it? We're going to be going out and I want to make sure you're doing as well as you can to enjoy this time we're going to have together. But somehow, it's important to remind them and to talk about it a little. And it may be, as Ken said, it may be that you have to kind of observe for a while. Maybe you notice something that they're not, moving as well. And it can be more of a approach of, it looks like you're slowed down a little bit. Did you take your medication? Or something where it's not quite as pointed as, look, you forgot it again, or, this isn't working, or something that's less, diplomatic in approaching it. But I would like to hear from Kat and Ken what they do in that sort of situation, or if it's occurred, what they would recommend.
I think it would be important to be asked how you want to be reminded about your medicines. And I think that it would drive me crazy if somebody was asking me constantly if I took my meds. Mm-hmm. However, I'm early in my process, and at some point it's going to become an issue, and I will need some prompting. But I think talking about how I want to be reminded will be important, and us having an agreement about how we're going to do that, and not doing it in the minute when I've missed a dose or been late for a dose. Does that sound reasonable?
That's excellent. Yeah.
Yeah.
Hint, hint.
Nighttime. Right, I'm making a note.
Yeah.
Yeah, it's so something that we've been, Kat and I have been talking about this, is that she's been having, I think it's a side effect, and we've been having a conversation about her just sleep pattern changes. And she has to take a medication at night, and sometimes she'll just fall asleep. And it's time for medication, and I have to wake her up and say, hey, Kat, I'm going to bed. You want some help getting your evening meds? And sometimes she'll say yes, and most of the time she says no, she just gets up and does it. So it is, and that's how she's wanted me to approach it, is like, just remind me once. And there's been times where I've noticed that she's more symptomatic during some middle of the day, and I'll ask her, hey, Kat, you seem a little more symptomatic. What's going on? And sometimes it's a missed med, and most of the times it's just it's just life. Just a different, you can't identify the reason.
Mm-hmm.
So,
Ken, while I have you on stage, I'm going to ask you another question. So somebody has this is a spouse who states that their spouse with PD has managed their own medications for 8 years, has done fine. That the person with Parkinson's is reluctant to have their spouse be involved in any way, and yet they're starting to have some difficulty. In particular, remembering the schedule. Do you have any suggestions how to help this spouse make that next step?
Yeah, let me think about that. I actually think would be, my first suggestion would find a group of people that are other care partners, and maybe a support group of care partners, and ask that question, and get some input from other people. And what if it was me immediately, my initial thought would be, ask my partner, well, what happens in an emergency, and I need to know what your medications are. What's a plan? What's the safety backup plan in that case? That's the only reason why I want to have some involvement, is just for safety reasons. And if you can structure the conversation around that, that's what I would do at first.
Okay,
yeah.
Nice. Dr. Mantri, I'm moving along because we have so many questions and we're running out of time, I'm sad to say. So this is about symptoms. And if the question is, how can I determine whether a symptom is progression and needs medication adjustment, or related to an underlying issue like a UTI or something else?
Yeah, so I would say in general, and this is a really broad generalization, but things that are related to Parkinson's progression will change slowly over time, sometimes so slowly that you may not necessarily notice day to day, which is one of the ways that keeping a diary or a log can be helpful, because then you can look back over the last year, the last month at a glance. Symptoms that are, or things that are related to external sources, like a urinary tract infection or some other kind of infection, or other neurological problems, or what have you, those tend to progress much more quickly, sometimes seemingly overnight or over the course of a few hours. So, and it's important to keep in mind that a urinary tract infection in somebody with Parkinson's disease may look like dramatic sudden worsening of their Parkinson's symptoms. They might not have any classic UTI symptoms at all. And it may just be suddenly the meds don't seem to work, suddenly all of the tremor, everything seems much worse, and we don't know where this is coming from. And if it's changed over the course of hours to a day, definitely looking for and checking for other causes, other treatable causes like a UTI are important. If it's something that's changed over the course of weeks to months, it's more likely, that's still a little bit, I'd say, fast for Parkinson's progression over weeks, but it certainly, it ends up being more on that side of things than something that changes abruptly, which is much more likely to be an external kind of force on your Parkinson's.
So thank you very much. Lisa, one other question sort of about the management of drugs, not so much the communication, but I guess it would also mean communication. This person is asking about suggestions for ordering medication and also doling out meds to their Parkinson's spouse. Do you have any suggestions about those things, how to do it most effectively, how to do it without making the person feel diminished?
So I think it's important to make sure that you, again, as Kat and Ken have so beautifully communicated, that you kind of talk to them about the best way to do this in advance. And especially if they're able to participate. I know some people may, for reasons of Parkinson's or other just aging, may have cognitive changes and can't participate. But if at all possible, try to discuss with them the best way to do it. And generally, I think the people that are most successful with it, if the patient is able to take the drugs and has a good reminder system, is to either set up a week or a day at a time so that then they have the medications and they can take them at the times they're supposed to take them with the alarms that they've set up or whatever system they have, so that it's not that kind of constant oversight or nagging or, just trying to be, in on every little thing, to give them as much freedom as possible and independence as possible to administer the drugs in a way that's, lets them keep their dignity and integrity.
Thank you. I'm so sorry. We are almost out of time. And I would like, first of all, I just want to thank all of our panelists so much for their words of inspiration, expertise, and insight. I want them each quickly to just give one takeaway message for all of our audience today. And I'm going to start with Dr. Mantri.
So I would say, from my perspective, the biggest takeaway is to remember that medicines can't stop or reverse Parkinson's progression, but they're so important at helping to treat specific symptoms, both on the physical and the non-physical side.
And the next one from, why don't we have Kat do the next one?
Okay. I would just like to reiterate that medications are important and they are only one tool in your toolkit. So develop a complex toolkit.
And Lisa.
I just want care partners to remember that you really do play a vital role in achieving the best outcomes for your loved one with their Parkinson's medications.
All right. Well, thank you all again. I want the audience to know that you will be getting a follow-up email. If you have suggestions for future webinars, please put those in. We love them. We use them. We make really good use of them. And one final thank you to US World Meds and Adamus Pharmaceuticals for supporting us in this webinar and the 3 to come. Thanks again. Bye-bye.